Welcome, everyone, to this informational video about pulmonary fibrosis. Pulmonary fibrosis is a serious and progressive lung disease that significantly impacts breathing and overall quality of life. In this video, we'll explore what pulmonary fibrosis is, what causes it, how it affects your lungs, and the ways it's managed. The exact cause of pulmonary fibrosis is often difficult to pinpoint. When a cause is unknown, it is called idiopathic pulmonary fibrosis, or IPF. However, several factors are known to increase your risk of developing the disease. These include genetic predisposition, environmental factors like exposure to asbestos, silica dust, or certain metal dusts, and certain medications, such as some chemotherapy drugs and heart medications. Connective tissue diseases like rheumatoid arthritis, scleroderma, and lupus can also lead to pulmonary fibrosis. Certain infections, such as chronic viral infections, have also been linked in some cases. Now, let's delve into the pathophysiology of pulmonary fibrosis. Essentially, it's a process of scarring in the lungs. Injury to the lung tissue triggers an abnormal healing response. This response involves excessive deposition of collagen and other extracellular matrix components, leading to thickening and stiffening of the lung tissue. These scar tissues prevent the lung from expanding and contracting properly, reducing the amount of oxygen that can pass from the lungs into the bloodstream. Over time, this scarring worsens, leading to progressive shortness of breath and other respiratory problems. The alveolar structure responsible for gas exchange is replaced by fibrotic tissue, thus severely impairing lung function. Pulmonary fibrosis affects a significant number of people worldwide. While precise global figures are challenging to obtain, it's estimated that idiopathic pulmonary fibrosis, the most common type, affects between 13 and 20 people per 100,000 worldwide. The incidence of the disease increases with age and is more prevalent in men than in women. It is important to note that these are general estimations, and the prevalence can vary depending on the region and specific diagnostic criteria used. The symptoms of pulmonary fibrosis can vary in severity and may develop gradually. The most common symptom is shortness of breath, particularly with exertion. Other symptoms include a dry, hacking cough that doesn't produce mucus, fatigue, unexplained weight loss, atching muscles and joints, and clubbing of the fingers and toes, where the tips of the fingers or toes become rounded and widened. The progression of these symptoms can be gradual over months or years, or it can be more rapid in some individuals. Diagnosing pulmonary fibrosis typically involves a combination of medical history, physical examination, and diagnostic tests. A doctor will ask about your symptoms, potential exposures, and family history. A physical exam will include listening to your lungs for characteristic crackling sounds called Velcro rails. Diagnostic tests may include pulmonary function tests to measure lung capacity and airflow, high-resolution computed tomography or HRCT scan of the chest to visualize the lung tissue in detail and identify scarring patterns, and in some cases, a lung biopsy, where a small sample of lung tissue is removed for examination under a microscope. While there aren't strictly defined types of pulmonary fibrosis in the way you might classify cancers, it's helpful to understand the different categories. Idiopathic pulmonary fibrosis, or IPF, as mentioned earlier, is the most common type, where the cause is unknown. However, pulmonary fibrosis can also be associated with other conditions, such as connective tissue diseases, environmental exposures, and certain medications. Classifying the fibrosis based on the underlying cause is crucial for guiding treatment strategies. Unfortunately, there is currently no cure for pulmonary fibrosis. Treatment focuses on managing symptoms, slowing disease progression, and improving quality of life. Antifibrotic medications, such as pirfenidone and nintedanib, can help slow the rate of lung function decline in some individuals. Pulmonary rehabilitation programs can help improve breathing and exercise tolerance. Oxygen therapy can help relieve shortness of breath by increasing oxygen levels in the blood. In advanced cases, lung transplantation may be considered. Furthermore, it's crucial to manage any underlying conditions that may be contributing to the fibrosis and to avoid further exposure to environmental irritants. While preventing idiopathic pulmonary fibrosis isn't always possible since the cause is unknown, there are steps you can take to reduce your risk of developing secondary pulmonary fibrosis. Avoid smoking and exposure to secondhand smoke. Protect yourself from environmental hazards, such as asbestos, silica dust, and other irritants. If you have a connective tissue disease, work with your doctor to manage the condition effectively. Get vaccinated against respiratory infections like the flu and pneumonia. The prognosis for pulmonary fibrosis varies considerably depending on the individual and the underlying cause. Idiopathic pulmonary fibrosis generally has a poorer prognosis compared to fibrosis associated with other conditions. The median survival time for IPF is typically between 2 to 5 years after diagnosis. However, some people may live much longer. while others experience a more rapid decline. Recent research is focused on identifying new biomarkers to predict disease progression and developing novel therapies. Clinical trials are ongoing to evaluate new anti-fibrotic medications and other treatment strategies. Furthermore, research is exploring the role of genetics in pulmonary fibrosis to identify individuals at higher risk and potentially develop personalized treatments in the future.